supine bridge as an assessment, what do I want to make sure does not happen? Lift up. I don't want to see a back arch or really an excessive round too much either. I don't want to see an excessive upper glute dominant. I want to make sure that she can do a low glute type of bridge. And it's really hard to just visualize it if you're not seeing a pelvic compensation. You may or may not know if it's the low glute or the upper glute, but what you can really see, come up into a bridge, and she does that. Remember that the upper glute is a big, powerful external rotator. Okay, so you may or may not see glute activity if you're looking pelvis. You'll see, lumbar extensors and maybe even like the hip flexors fighting, but you will see that external rotation at the hip if those upper glutes are taking over. So we want to make sure that there's no deviation. We want to make sure it is straight up with no deviations. Now, there really is no, there's no like set textbook mid-range muscle test for this type of thing, but I can say come on all the way up. And she should have a nice horizontal line, and I can test her on her ASISs pushing down to see her inner range strength, and I can see, does she get a deviation? Relax. So I can make up a mid-range, but there really is no documented mid-range test for that, but I can test her at that inner range and drop her down a little bit more and test mid-range. Okay, so that's one option with the glute. The other one is flip over. Okay. This can be a stretch for the hip flexors, but I really don't like it, is that you can stabilize here and lift the leg straight up. It's not a stretch that I really like, but just know that that's an option. But if I want to really target glute, I can have her bend her knee and now try and just lift straight up into the air. She gets a little bit of pelvis in on that, relax. If she tries to do that and this happens with an internal rotation, okay, that's telling me something. If there's an external rotation, okay, that's telling me that definitely that glute max, that superior glute max is coming in. Maybe piriformis is a little bit overactive. If I'm getting adduction, okay, I might be getting the adductor magnus a little bit more too. The external rotation can also be the biceps femoris because that acts a lot at the hip. Internal rotation is rare. It can sometimes be the medial hamstring, but not so much. You might just be seeing like a range of motion limitation that's not allowing you to go into external rotation. So it's like biasing that. You don't really see a muscle compensation for that, but it is possible. Okay, so external rotation is probably going to be the most common, maybe even adduction when they're coming in, and especially you're getting the firing of the lumbar extensors, which should not be happening. So those are the deviations. When she comes up, good. I can test her inner range right then and there. Hold, 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 hold. Look for deviations. It's hard to drop her down into mid-range because there's such a slight difference. Really, this is where she should be. So she really wasn't even getting to active range. When I did her test, it was more mid-range. But that's kind of what you want to try and do is come all the way up, make sure that she's there. She's hiking just a little tiny bit. Hold, 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 hold. And she really sinks down to her mid-range muscle test position. So inner range-wise, she doesn't have it there. Okay, and it can be that it's a local firing issue. I would have to give her a motor cue, provide external stabilization. I might have to externally stabilize even by doing something with my forearm so that I can still test. So you might have to get a little creative with how you apply external stabilization. So those are the glute ones for now. I think that was it. We went over all the compensations. So try those two. Just really quick, go through the motion. Go up, test for active equal passive, try inner range strength, try mid range, and then switch partners.